Good afternoon. We're here to give an update on COVID-19 in Oregon. I'm joined by Patrick Allen, Director of the Oregon Health Authority, Dr. Dana Harganani, OHA's Chief Medical Officer, Barry Pack, Director of the Oregon Lottery, and Dr. Ashby Monk, Executive Director of the Global Projects Center at Stanford University and co-founder of Long Game Savings. Well, Oregon, I'm pleased to say that together we have made real progress at tamping down COVID-19 after we faced the last surge. Our hospitalizations today are at 285, the lowest they've been since April. 6 counties have vaccinated 65% or more of their residents 16 and over, and statewide, we're now at 63% of adults vaccinated. Every single day, we are getting closer to ending this chapter of the pandemic. With summer just around the corner and life starting to return to normal, I think we're all feeling excited and hopeful that good days lie ahead. But we aren't there just yet. In this final push to reach every Oregonian with a vaccine and to meet our goal of at least 70% of adults vaccinated so that we can fully reopen our economy, we will need to pull on every lever we have. So if you've been waiting to get a vaccine or you just haven't gotten around to it yet, we're going to give you an extra incentive. How about a chance to win $1 million? Take your shot, Oregon. Roll up your sleeves and get a chance to change your life. We are encouraging all eligible Oregonians to get vaccinated for the chance to win money and education scholarships. All Oregon residents who have received a COVID-19 vaccine will be entered in the Take Your Shot Oregon campaign and are eligible to win. There will be $1 million winner for residents 18 and over. 5 $100,000 Oregon College Savings Plan scholarship winners for Oregonians ages 12 to 17, and each of Oregon's 36 counties will have a $10,000 winner as well. All Oregon residents who've received at least 1 dose of their vaccine by June 27th will be eligible in our Take Your Shot Oregon campaign and entered to win through our state vaccine database. That includes a first dose of Pfizer or Moderna or the Johnson & Johnson vaccine. With help from the Oregon State Treasury and the Oregon Lottery, the Oregon Health Authority will conduct a drawing to randomly select the winners in each category. Winners will be notified and able to claim their prize or opt out if they prefer. The drawing will take place on June 28th, with winners announced the following week. Getting vaccinated not only protects you from COVID-19, it helps protect your loved ones. It takes us one step closer to unlocking the restrictions we have endured during the pandemic. And in Oregon, it now gives you a chance to win $1 million. That sounds pretty good. And right now, getting vaccinated is easier than it's ever been. Local public health and community-based organizations are partnering with healthcare providers to improve access to our most vulnerable neighbors. There are pharmacies, community clinics, and medical offices across the state that have available appointments. For example, just this week, the Oregon Convention Center, one of our mass vax sites, celebrated that they have given 500,000 shots. You can walk in and get a vaccine even without an appointment. If you still have questions about getting the vaccine, go ahead and get your questions answered. Call your healthcare provider or drop by your local pharmacy and ask the pharmacist. Our website, covidvaccine.oregon.gov, also has great resources and information. We can do this. I'm encouraging every eligible Oregonian to take your shot. Go get vaccinated. It can save your life and just maybe make you a millionaire. I've invited Dr. Ashby Monk of Stanford University and co-founder of Long Game Savings to join us today. He has over 2 decades of experience designing decision-making processes to help people make smart choices. He'll be sharing more about the data and research behind incentives like these. We are really grateful for his work over the past few weeks with our teams to get us here today. So with that, Dr. Monk, the floor is yours.
Thank you so much, Governor Brown, for this incredible opportunity. First of all, thanks to the whole team at Oregon for the chance to work on this project. When Governor Brown and Treasurer Reed's teams reached out to me back in April and asked if I would consider brainstorming creative ways to motivate people to get vaccinated, I think I may have literally jumped out of the chair I'm currently seating in. I was just incredibly excited to volunteer my time and share all that I know about this issue of motivating people and organizations to make complex, important decisions. That's what I work on, helping them do what's important for them and for society. I've been doing that, as the governor said, for about 20 years, designing decision-making processes to help people and organizations make the smart, the positive, and the effective choices. We want these choices to be made in their self-interest, even when there might be confusion or anxiety or even fear. In these cases where people are afraid about an action or a decision, we've learned that messaging that is based on fear, such as showing the negative consequences of not doing some action, or even the messaging that is sometimes rational, arguments about the science or education, these can struggle to get through to those individuals who are feeling the anxiety and the stress. It's tough to cut through. Many of the researchers and academia with me, we found one tool, surprisingly, is incredibly powerful, and it's games. Games, and I should say variable reward incentives. These incentives are powerful, such as raffles or other games of chance. Today, games and variable reward incentives are really at the cutting edge of the science of motivation. My guess is many of the people on this Zoom are already using gamification techniques right now to help you make tough decisions and improve your lives, to help you eat right by tracking your food calories and leveling up every day, to work out more, competing against your friends through different applications, study longer. I use it to sleep better. The academic research backs all this up. Games increase extrinsic motivation across a range of difficult and different decision contexts. And I can tell you from my work over the last 5 years that the notion of prize-linked savings programs, these are programs where we actually award people raffle tickets when they save money. They make a positive step in their personal finances and they win cash prizes for doing so, is incredibly successful. Please forgive the academic for citing research, but I have a couple of papers that I think clarify this incredibly well. In fact, a very recent one written by Gertler and co-authors in 2021 that showed a randomized prize-linked saving experiment. It was across 110 bank branches. The number of new accounts opened increased by 41% in the months when there was a raffle for cash prizes. The opportunity to win a cash prize boosted uptake of new savings accounts by 41%. And it gets better. To me, this is even more exciting. Nearly all of those savings accounts, 96% of them, were opened by people that would be prior described as unbanked. They had no banking relationship up until that point. And the chance at winning a cash prize drove these people to do something they had never done before. If we can get this kind of uptake from games for the unbanked, there's reason to be quite confident that we can use the same mechanism to motivate the unvaccinated. And there again, have patience with the academic on the call here. I can cite another academic study that shows that games, and this paper is in 2020 by Montagny and co-authors, games are been shown in vaccines to enhance vaccine knowledge and improve vaccine uptake. Games drive the behavior that we would like to see. There's tons more data that I could pull to, and I'm happy to do so in questions or after the conference. But I think the punchline is this: incentives that can change your life with big financial rewards really do inspire large groups of people to take positive action. If we can get 20 to 40% more of the people in Oregon to choose to get vaccinated among the hesitant or the population today not prioritizing getting the vaccine, I think we could save many lives, many lives. And so that's why I jumped out of this chair to work on this project, but I quickly got back into the chair to begin writing a proposal for Governor Brown. And I have one final thought, and then I'll turn it back to you, Governor Brown. I'd like to do a shout out for the history buffs out there. I will tell you that this is not, the COVID crisis would not be the first time that a government used a variable reward incentive program or a game to confront a serious or even an existential threat. In 1695, the English government used a game called the Million Adventure to raise funds for their war against the French. The government sold 100,000 tickets for £10 each. Each ticket afforded a person a chance to win a generous, life-changing prize. The game was hugely successful. Even people that couldn't afford to participate pooled their savings to get into what they called at the time syndicates to play. The government got the money they needed to fight the war. The people were more than happy to give up their cash in the short run with the promise of getting paid in the long run. And so, as a final thought, my hope is that 3 centuries later, Oregonians, I hope, will come together like the English did. They'll drive each other to get vaccinated. They'll form a syndicate, and the community can come together, take a shot, Oregon, and win enough money to change your lives. So with that, thank you very much. And I'll turn it back to you, Governor Brown. Thank you.
Thank you so much, Dr. Monk. We certainly appreciate the history lesson and your time and your enthusiasm. And with that, I'm going to turn it over to Director Pat Allen of the Oregon Health Authority. Director Allen, the floor is yours.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority, and I'm joined today by Dr. Dana Harganani, our Chief Medical Officer. As we get ready to see the first counties in Oregon move to low risk after they reach the 65% vaccination target, I want to provide some brief updates on our progress against the pandemic and the growth we've seen in vaccination rates. First, recent trend data clearly show the latest COVID-19 surge is waning. Over the past week, we've seen a 16% drop in newly reported cases each day, marking the second consecutive week cases have fallen. Our 7-day moving average for daily cases is 486, which is 40% lower than it was on May 1st. These numbers are consistent with the modeling report Dr. Seidlinger, our state epidemiologist, released last week. That model estimated that transmission rates had fallen below the level the virus needs to spread at a self-sustaining rate. The drop in new cases is in line with that forecast, and this turning point is likely due to multiple factors. Extreme risk protections pumped the brakes in counties with the highest infection levels. Warmer weather invited more people outside. Most Oregonians continue to wear masks and limit the size and frequency of social gatherings, and most important, more Oregonians have been getting vaccinated every day. However, hospitalizations and deaths, which are both the most severe and tragic outcomes of COVID-19 and the last indicators to change, remain high. Over the past week, Oregon recorded 57 COVID-19 deaths. That number is the highest total in 10 weeks, and it's a grim reminder of the threat COVID-19 still poses to the lives of Oregonians of all ages. We're reporting the loss of 7 more Oregonians today, and my deepest sympathies go out to their families and friends. As of today, there are 285 COVID-19 positive patients in Oregon's hospitals. We've declined significantly over the past week and since the beginning of the month. Nevertheless, hospitalizations are still too high, continuing to stress doctors and nurses in ICUs across the state. But it's encouraging to see them coming down. I also want to note that hospitalizations for African Americans have spiked in recent weeks. We cannot let an overall downward trend mask a disturbing development for a community that's been hit especially hard by COVID-19 all across the country. We're working with community organizations and local health officials to speed vaccinations for African Americans in Oregon and prevent more cases of severe illness in the community. As we try to stamp out the virus, we continue to see increases in our most effective tool to end the pandemic, vaccinations. Let's look at our latest vaccination numbers. Oregon's vaccination totals continue to grow. We remain on track to pass Governor Brown's target to vaccinate 70% of adult Oregonians before the end of June. 63% of Oregonians who are 18 or older have received at least one vaccination. More than 2.1 million Oregonians have received at least one dose of a COVID-19 vaccine. According to the latest data, 1,656,783 Oregonians have been fully vaccinated. Oregon vaccinators have now administered at least one shot to 52% of our total population, according to the CDC. Oregon now ranks 19th in the nation, including the District of Columbia, in the percentage of our total population who have received at least one dose. The national average is 48%. As of yesterday, Oregon is averaging a total of more than 29,000 first and second doses each day. Most important, we're continuing to see the rate of vaccinations pick up among communities of color. Over the past week, the rate of change for African Americans was nearly 9%, and for Latinos and Latinas, it was 7%, while for whites, it was just under 5%. That's an encouraging sign that our partnerships with the community are continuing to expand vaccination opportunities and build confidence among communities of color. Over the past week, our total statewide percentage change for everyone 16 and older was 1.3%, which was down from the prior week. But that figure was affected by an abnormally low number of vaccinations on and around Mother's Day. The numbers have picked up again recently. As of now, we remain above the rate we need to reach the targets Governor Brown announced last week. As you know, we plotted scenarios that took into account our current growth rates and any potential drop-offs of 10, 25, and even 50%. Under all our current scenarios, Oregon is on pace to vaccinate 70% of adults before June 27th, at the latest according to those scenarios. As we track Oregon's vaccination targets, let me clear up some confusion about the numbers we're using to calculate this metric. We're using the CDC's calculation of the percentage of people who are 18 and older to track our progress toward our state level target to vaccinate the 70% of adult Oregonians required to lift risk metrics. We do this for a couple of reasons. First, the CDC data offers a more comprehensive, complete, and accurate picture of total vaccinations in Oregon because the federal data includes vaccines administered by the Veterans Administration, Indian Health Service, and other federal entities. The CDC data also enables us to track our progress against the goal the Biden administration has set for the nation. The CDC data is less reliable at the county level because it doesn't always include the county of residence information for people who are vaccinated through those federal entities. For county vaccination rates, we'll rely on Oregon's Alert Immunization Information System. In the past, CDC reported all eligibles in their data reports, which included 16 and 17-year-olds with adults. That's why you've seen some definitions of our statewide 70% vaccination target refer to 16-year-olds. CDC's data reporting categories changed when older children between 12 and 15 became eligible to get vaccinated. Now CDC's report for people who are 18 and older only includes adults. Now let's talk about our county targets, where we're also continuing to see progress. On Monday, 5 counties became the first in the state to move into lower risk after vaccinating 65% of eligible residents with at least one dose and submitting vaccine equity plans to OHA. Those movements to lower risk took effect today. Those counties are Benton, Deschutes, Hood River, Lincoln, and Washington counties. That's an exciting milestone in this pandemic. And as I said last week, the diverse range of population sizes, geographies, urban, suburban, rural, and coastal mix of these counties shows that every Oregon county has the capacity to reach the 65% target. Looking ahead, we know other counties have reached the 65% threshold since last week, or they are on pace to do so. Multnomah County is now above 65%. Lane, Polk, and Tillamook counties are near 60% or above. We look forward to working with these counties and every other county in Oregon to support their equity plans and help them reach the 65% target to move to low risk. There are many reasons to get vaccinated. We know from national surveys and surveys we've conducted in Oregon that more and more people are choosing to get vaccinated. For many people, the question hasn't been whether to get vaccinated, it's when they can fit a COVID-19 vaccination into their busy lives. I believe the incentives Governor Brown announced this morning will encourage many Oregonians to prioritize getting vaccinated in the coming weeks. Getting vaccinated is a very personal decision, but it makes a big difference for you, the people you care about, and everyone around you. Oregon is closing in on our 70% vaccination goal, which will allow all of us to return to a more normal life without the restrictions and limitations we've had to rely on to fight COVID-19 for the past year and a half. To find out where to get a vaccine or get answers to your questions, go to covidvaccine.oregon.gov and make your plan to get vaccinated. With that, I'll turn it back to you, Governor Brown.
Thank you, Director Allen. Charles, we're ready for questions.
Thank you, Governor. Our first question is from Pat Duras from KGW. Go ahead, Pat.
Geez, I was hoping you'd call me last. I have just a technical math question. Last week when the governor mentioned the new 70% guideline or goal, there were 430,000 people that needed to get vaccinated to meet that goal. And it looks like between now and then, about 141,165 actually have been vaccinated. I'm just wondering if you can verify these numbers, that there's roughly about 288,800 left. And at the rate that we're going, it appears you might be able to hit that by June 9th or 10th.
Thank you, Pat. I'm going to turn the math question over to Director Allen, but roughly your numbers are accurate. Director Allen.
Thank you.
Yeah, thanks, Pat. I'm not going to try to do math, verify your numbers on the fly here, but as the governor indicated, I think you're roughly in the ballpark, and we can do a little bit of confirmation offline and get that information back to you.
My encouragement to Oregonians is to take your shot now. You have an opportunity to win $1 million, and we have an opportunity to beat California with fully reopening the economy if we can get close to 250,000 Oregonians vaccinated in the next few weeks.
The one thing I might add to the answer, Pat, is that absent the effect of the Take Your Shot challenge, the 9th might be a little bit optimistic, because that rate of increase is tending to decay over time, day by day, which we kind of forecast last time. But I think the challenge will have a big impact on that. So you got to factor that into calculating dates too.
Okay, thank you. I just wanted to ask that so we could all sort of keep a running tally and see where we're at. Appreciate it.
Thank you, Pat. Our next question is from Lisa Balick with Coin. Go ahead, Lisa.
Yes, hello. Couple questions. Why not go with a prize game with more winners and weekly prizes awarded to get more engagement and interest? And also, what % increase do you expect from this gaming effort? You said if we can get 20 to 40% more is what Director Allen said, but what's the actual number? And also, why not go with those weekly winners and weekly prizes to really get more engagement?
Thanks, Lisa. I'll turn those questions over to the Director of the Oregon Lottery, Barry Pack, and Dr. Monk. Director Pack, do you want to tackle it first?
Yes, thank you, Governor. Thank you, Lisa. When we put this game together, one of our goals was simplicity and the opportunity to have Oregonians focused on a life-changing prize with the limited funds that we had available. So in order to get this stood up quickly so that we could take advantage of every weekend and every day for an Oregonian to take their shot, we wanted just a simple one-time drawing and to spread those winnings to not only $1 million winner statewide, but also to make sure there was a winner in every county, so that we know the virus is in every county. We want to have a winner in every county as well. And I'll let Dr. Monk answer the question about % of increase.
Yeah, I think first off, it's an astute observation to say that the small prizes drive engagement and, in fact, retention. So these small prizes help to show legitimacy of the program. I think that's why the design of this lottery includes the county by county 10,000 program. It's not necessarily a small prize, but we were optimizing in our design for simple and speed and getting us to the key goals for July 4th. So that's every time you're designing something like this, there are a bunch of constraints that you need to abide by. Was the second question, how do we get to 40%? Was it 40%? Say that one more time.
Yeah, what's the percent that you expect to increase from the gaming effort?
Yeah, I think it's hard for me to judge right now based on some of the other incentive rewards we've seen in private sector variable rewards like this, raffles, an increase among populations of 20% increase among the hesitant, not necessarily among people who've said they're definitely not going to do it, but among the people that are at this, what we call extrinsic motivation period. There's also A-motivated and intrinsic motivated as sandwiches. The A-motivated we're not going to touch. The intrinsically motivated have already gotten their shot. We're targeting that extrinsically motivated that need some kind of incentive. And our hope is somewhere between 20%. And if we believe this research that came out just in 2021 about prize-linked savings, maybe we can hope as much as 40%. But I think this is an experiment. And so we're going to hope for the best and use all the science we have to influence the design.
Thank you.
Thank you, Lisa. We'll go next to Brett Taylor with KDRV. Go ahead, Brett.
Hi there, Governor. Thank you for taking my question. Currently, I'm looking at data right now on the Oregon Health Authority website that shows that vaccination doses are decreasing right now in the wrong direction, and that the 7-day running average compared to that of April has dipped down by about 13,000 doses per day. I was kind of curious why you think that this is happening right now and how this campaign might increase those doses administered in about the next month or so before this campaign ends.
Director Allen, do you want to take that question?
Yeah, I can take a first crack at it. And you're right, the average daily rate has dropped, although it's ticking back up again now as we get past that Mother's Day dip that I talked about, and as we have more people eligible. Last week, I think it was, I talked about there being categories similar to the ones Dr. Monk referred to. I talked about vaccine resistant, vaccine hesitant, and vaccine inconvenient. I think what the Take Your Shot Challenge really provides is an opportunity, especially to get the vaccine inconvenient. People who have no particular concerns or challenge or worries about the vaccine, but just haven't had the time or the opportunity or carved out a spot in their day to go get that vaccine. And we think the challenge will provide a great opportunity there. I think it's also got the opportunity to provide some incentive for other folks, but that really is what the idea is with this incentive, is to get people motivated to take that last step to get the shot. I don't know, Dr. Monk, do you want to add to that at all?
No, that's right. That sounds exactly right. This is about just taking those communities that are already interested or not vehemently opposed and getting them to take that shot. And this is a great motivator. Like I said, sometimes you need a creative tool to cut through some of the anxiety and fear and misunderstanding. And this is that kind of a creative tool to cut through and help people make the right decision.
Thank you.
Thank you, Brett. We'll go next to Amy Green with the Oregonian. Go ahead, Amy.
Thanks. I have two questions. First, what happens after we reach the 70% target of 16 and older vaccinated? Governor, would you set a new target? And how do we get people to reach that target? What's our next move? Or are we just saying all's good when we reach 70%, which is really probably like, maybe you can tell me, 55, 60% of the overall population?
The reason I set the target of 70% of adult Oregonians receiving one vaccine, one shot in their arms, is because I wanted to have a very clear goal for Oregonians to reach. And it would be the point at which we would release the safety protocol that the pandemic has forced upon us and fully reopen our economy. So very clear targets, very clear goal. We provided the Take Your Shot Oregon Challenge because we want to provide additional incentives for Oregonians who haven't chosen to get vaccinated. And we think it's very doable and we can easily reach this by June 30th.
But yes, what's the next target? Is there a next target? Do we want to try to go for 70 to 85% of the overall population vaccinated? And how would we do that?
Well, I fully expect the state of Oregon to continue partnering with our local health providers, our local public health and community-based organizations to continue vaccinations and through the summer. And ideally, we would get those numbers up substantially higher than 70%. We'll continue to focus with our partners to get it up as high as we can. I know that there are some populations that have done an extraordinary job. I was on a call yesterday with the chairs of the 9 federally recognized tribes. The chair of the Coquille tribe, they have received over a 90% vaccination rate for their tribal elders. We would certainly like to get our vaccination rates up at that level. Director Allen.
Yeah, if I could expand on that a little bit. I mean, you know, the phrase herd immunity has been kicked around a lot, and a lot of the emerging discussion has been that it's actually hard to know what that is or whether we can get there. But I think short of maybe establishing a hard numeric goal without a lot of information to base that on, we want to get more. We're going to get more because the vaccines are going to become eligible to be used with younger and younger kids. Certainly Pfizer is headed down that path. I expect Moderna is as well. And as those populations expand, we'll want to be able to get more of those folks vaccinated. And you're right now the 70% of 16 and above is about the range that you've identified. Getting more kids eligible will help us drive those numbers. And then we're going to really need to work on communities that we are having a hard time getting vaccinated, and whether that's communities of color that haven't had good access to the vaccine or have particular hesitancy, or counties where the rates are just really low for a variety of local reasons. I think that's what we're going to spend the next months after the 1st of July focusing on, is who hasn't gotten vaccinated, why haven't they, and what do we need to do to be able to get them vaccinated?
Thank you. Just really quickly, is there a possibility of holding future lotteries after June 28th? It's a relatively cheap option, right? $1.86 million. And what other incentives, Governor, would you consider? How about paying each resident $25 or marijuana or, whatever?
Trust me, I have all of my friends, family, and anyone who has my phone number texting me concepts of incentives to encourage more Oregonians to get vaccinated. From my perspective, we continue to make decisions based on research and data, and that's why Dr. Monk's work has been incredibly invaluable for this effort. I'm certainly open to other ways to incent and motivate Oregonians to get vaccinated, and we'll continue to discuss them as we continue to vaccinate Oregonians across the entire state.
Thank you, Amy. We'll go next to Bridget Chavez with KPTV. Go ahead, Bridget.
Yeah, will this lottery really convince people who are on the fence? I mean, we're getting a lot of comments and emails from viewers on social media also crying bribery. So what do you say to those people?
Bridget, I'm going to turn that question over to Dr. Monk.
Yeah, the objective here is not, the objective here is to create a new incentive to do it, right? To do what's in their self-interest and to push the community in Oregon into that target herd immunity level. In fact, at one point we joked about calling this program herd annuity because ultimately we wanted to create a financial prize for getting a collective level of health and being able to open up the state. I didn't realize, I'll admit, Governor Brown, that there was a contest going on with California when I agreed to help. But here I am helping you beat my home state. So look, this is not meant to be a bribe. It's an incentive. And so we are trying to create an incentive to participate. And I would probably go back to Barry or Patrick. I think people can opt out if they don't have to play the lottery if they don't find the incentive appealing. I don't think many people will, but I think there is that option.
And Bridget, I'll just add, we'd been discussing this concept with Dr. Monk for a couple of weeks. And so we were a work in progress when Ohio released their challenge. And we've been in touch with officials from Ohio. And it's my understanding that it's been very successful in Ohio, and we like to replicate best practices. We took the concept of the college scholarship. We took that from Ohio and put our Oregon fingerprints on it. And I'm hoping it will be successful and encourage more Oregonians to get vaccinated.
Thank you, Bridget. We'll go next to Genevieve Rayom with K2. Go ahead, Genevieve.
Hi, Governor Brown. Thank you. Oh, thought it was muted there. All right. Thank you for taking my questions today. I hope you guys are able to hear me. I have a few, but they're all on the same topic. So the first question is, Governor Brown, can you explain how a vaccine passport differs from what businesses are required to see to allow people inside without masks?
In terms of a vaccine passport, I look at this as vaccine verification, and that is providing proof that you've been vaccinated. The first part of your question is, how does that differ? We're asking businesses to make a decision. They can continue to mask like we've been doing for a number of months now, or they can ask their customers, their clients, for vaccine verification. I know I've certainly heard from businesses and frontline workers that this is incredibly challenging. We're committed to having the conversation over the next couple of weeks. But the reality is that this is an interim measure until we can fully lift our safety protocol. And that's why we're doing this release of the Take Your Shot Oregon Challenge today, because we want to encourage Oregonians to get vaccinated as quickly as possible so that we can fully reopen our economy.
So are you saying that this requirement of businesses to check vaccine verification or verify vaccine that people have gotten their vaccines, are you saying that that will be no longer required once we hit 70%?
That's correct. My expectation is that we would fully reopen the economy and lift the safety protocol. Obviously, we will wait to see what the CDC continues to do regarding masking and social distancing, but that is my expectation.
And I know you mentioned that you've heard from businesses and vendors who really feel the weight and this responsibility. What is the state's role in all of this? How is the state enforcing this?
Well, we've continued to set guidance, guidelines. The Oregon Health Authority reached additional guidelines, released additional guidelines this week. We are asking Oregonians and businesses to comply with the safety protocol because of the relatively high rates of infections that we have throughout the state and the numbers of hospitalizations, and until we get more Oregonians vaccinated. And that's why we're announcing the challenge today, the Oregon Take Your Shot Challenge, because we want to get more Oregonians vaccinated as quickly as possible.
Okay, just this last question here. As far as the state's role, does OSHA play a part here? Are they going to be going into businesses and making sure that they're actually checking vaccine status?
Look, as I said, this is an interim measure. We ask businesses to make the determination about what is best for their business model to continue the masking policies that we've had in place or move to some type of vaccine verification. OSHA obviously has the authority to enforce these guidelines. As I said, this is a temporary interim step. If we can get, whether you rely on Pat Doris's math or not, if we can get roughly 250,000 Oregonians vaccinated in the next couple of weeks, we can lift the safety protocol that the pandemic has forced upon us. And I think we are all looking forward to that. And that is where I am focused at this time. is getting Oregonians vaccinated and lifting the safety protocol.
Thank you, Governor Brown.
Thanks, Genevieve. We'll go next to Chris Lindsay with KEZI. Go ahead, Chris. Chris, are you there?
Oh, sorry. Okay, sorry. I think I was muted. Can you hear me?
Yep, go ahead.
We can hear you, Chris.
Okay, so I'd like to go a little bit more in depth about the previously vaccinated. Is this something as simple as today at noon, we starting the count? If someone were to be in between doses right now, are they then entered into the lottery? And then secondly, how do they receive notification that they won it? Is it a letter, call, so on and so forth?
Good questions. I'm going to turn this over to the director of the Oregon State Lottery, Barry Pack.
Thank you, Governor. Yes, so anyone who is currently vaccinated, so they've either received a single dose of the Moderna or Pfizer or the Johnson & Johnson vaccine will be entered into the drawing by the draw date. Anyone who's not currently vaccinated and gets vaccinated between now and the 28th will also be added into that database for the drawing to take place. So currently vaccinated are eligible and entered, and if you get vaccinated or get your first shot, you will be added to the eligible list. As far as contacting the winners, that's dependent upon the contact information included in the database, and that will be handled through the Oregon Health Authority to maintain patient privacy.
Thank you.
Thank you, Chris. We'll go next to Rachel Monahan with the Willamette Week. Go ahead, Rachel.
Hi, thank you. So I wanted to ask a couple of Multnomah County specific questions, since it was mentioned that Multnomah County has achieved the 65% benchmark. The first question is, how would, and I think this is a question for Director Allen, but you tell me, but how would you characterize the current spread of COVID-19 in Multnomah County at this point? Should people be on the alert? Like, how widespread is the virus at this point? Can, people drop masking essentially? Like, should people feel comfortable dropping masking even if they're not vaccinated, given that we have basically hit the state benchmark?
Rachel, I'm going to turn these questions over to the Oregon Health Authority. Dr. Dana Harganani, do you want to tackle those questions?
Sure. Thank you for the question. I think what we know is that having been vaccinated, you significantly have a lower risk of COVID-19 and lower the risk of transmitting that to others. So where we're really focused with our current guidance around masking is for people who have been unvaccinated, particularly in indoor settings. And that would be true currently for Multnomah County and other counties as well. Multnomah County has achieved really great gains in vaccination rates, which we are thrilled about. Again, our focus is on ensuring we're continuing masking indoors for people who aren't protected by the vaccine at this point.
Okay, but that didn't talk about the spread of the virus, nor did it talk about the fact that the governor is talking about getting rid of mask mandates when the whole state has essentially reached the vaccination rate that Multnomah County has reached now.
I can try to tackle this a little bit. We think statewide, as I indicated, related to the models that Dr. Seidlinger shared last week, that our replication rate has dropped below 1, and that means the virus is now not replicating at a sustainable rate. Our test positivity across the state and in Multnomah County has been dropping, though it's still above the 5% target, both statewide and in Multnomah County, that we'd like to see. And so, I think the trends are good, but we're still at where we were in about early April, when we were at a place of concern and on our way up in terms of this most recent surge in cases. I think what we're talking about right now are risk metrics that change to the lower risk metrics around things like restaurant capacity and hours of operation and those kinds of things. They don't really speak to the masking issue. What's going on with the masking issue is we're saying that it's safe for people not to wear a mask outdoors, because we've got really good data about really low risk levels of transmission outdoors. And indoors, what we're really saying is if you have not gotten a vaccine, you really need to continue to wear a mask to protect yourself and to protect others. If you've gotten a vaccine, then it is safer to go without a mask, but that's dependent on the people who haven't been vaccinated yet wearing their masks.
Okay.
And so, Rachel, I also want to be perfectly clear, and I just got off the phone with Dr. Walensky of the CDC this morning. We are talking, post reaching our goals of 70% vaccination, one shot in adults' arms, and lifting the metrics and the safety protocol. We would still continue to align with the CDC regarding masking guidance. And again, as you are well aware of, that does change. But for example, it may be that the CDC may continue to require masks in healthcare settings because of folks that are in those settings that are medically vulnerable. People who are undergoing chemotherapy, for example, are particularly vulnerable and may not be able to be vaccinated.
And one last question on Multnomah County. They submitted a letter asking to move to lower risk based on an equity plan now and their vaccination rate for as soon as Wednesday. Are you going to consider an early move for the county to open up capacity at restaurants and venues instead of waiting for next Friday?
Director, I will turn the question over to Director Allen because of the review of the equity plan.
Yeah, I believe that their request is under consideration. If anything is done along those lines, it would apply to anybody else who might be similarly situated as well.
Thank you, Rachel. We have time for just 2 more questions. We'll go next to Isabella Garcia with Portland Monthly.
Hi. I'm just curious, you're talking about with vaccine verifications potentially being lifted when the state reaches the 70% vaccination status, depending on, the CDC, and with the acknowledgement that the benchmark is like focusing on vaccine inequity. Are you concerned that communities of color will continue to face higher rates of COVID as the state opens up, as you reach that 70% benchmark, that, then we'll be focusing on really addressing those inequities after the state reaches that benchmark? Are you concerned that communities of color will be left behind in that process?
I am continuing to focus on closing the vaccine equity gap. The Oregon Health Authority is working with community partners, community-based organizations, local public health. We are working with organizations to make sure that these communities of color that have been disproportionately impacted by the pandemic will have access to the vaccines. Sometimes that means providing mobile efforts, taking vans into communities, into neighborhoods. Sometimes it means working with employers to have vaccine sites on the employer site. We are doing all of these to work to close the vaccine equity gap. And then I am absolutely focused as the governor of the state of Oregon in closing the equity gap in healthcare more broadly, and frankly, in all of our cultures, institutions, and systems. And that will be the focus of my work over the next year and a half in my role as governor. Director Allen, do you want to talk a little bit more detail in terms of the work that's happening, please?
Sure. As I indicated in my comments, we are in fact currently closing that equity gap. The rates of increase of vaccinations in communities of color, particularly Black and Latina are higher right now than for the white population. And I think that's evidence of the work that the governor talked about that we're doing with a variety of community organizations trying to, in those cases, get to access issues as well as hesitancy questions and those kinds of things. And we're going to continue to do that work throughout the time up to the first and then beyond. Is really part of that notion of how do we figure out who's not gotten vaccinated and why, and what do we need to do to get them vaccinated.
And I will just add, unvaccinated people are more vulnerable to the virus. I am concerned about communities that are having low rates of vaccination because they are medically more vulnerable to COVID. A lot of these communities are already, from a healthcare standpoint, more vulnerable. And so we're going to do everything in our power to make sure that these vaccines are accessible and available, and that we meet communities, meet families where they're at. And that was some of the criteria in my reopening strategy.
Okay, thank you.
Thank you, Isabella. Our last question today goes to Carmen Montes with Univision. Go ahead, Carmen.
Thank you. Governor, you have been mentioning the lottery. Is this lottery going to be open to all Oregonians, including those that are undocumented in the state?
Absolutely. All Oregonians who have received at least one vaccination as of June 27th will be eligible. We obviously have a specific lottery for young people, but all Oregonians 18 and over are eligible.
Thank you, Carmen.
Also, I wanted to ask, is this going to be affecting those that may have any type of benefits like SNAP, WIC, with the public charge rule? Is that going to impact them at all?
All Oregon residents who have gotten vaccinated, at least one shot as of June 27th, will be eligible to participate in the Take Your Shot Oregon Challenge.
Could I expand on that just a little bit, Governor?
Sure.
I don't think the public charge rule is quite the concern that was before, because the proposed changes to that rule have been withdrawn. I do think there are complicated questions about tax implications, benefit implications, and those kinds of things that winning a cash prize can have. And I would say that as public agencies, we're not able to provide advice on that. But if someone is in a position to win this challenge, that they might want to seek out that advice.
Thanks, Pat.
Thank you, Governor.
I think those
Thank you,
those
Carmen.
all the time we have for questions today.
All right, here's your chance, Oregonians. Take your shot, Oregon. Let's get everybody vaccinated. Have a great weekend.